And then last thing, is it pronounced Bruggemeyer, our mental health virtual fair, joining us with Chinatown Service Center and Monterey Park Bruggemeyer Library. My name is Monica with Chinatown Service Center, and I'm here with Deborah from Monterey Park Bruggemeyer Library. And I will be your host for today. So let's go ahead and get started. So with May being both Asian American Pacific Islander Heritage Month and Mental Health Awareness Month, Chinatown Service Center and Monterey Park Bruggemeyer Library are proud to present our mental health virtual fair and provide mental health services for the public. We wanted to host an event that catered to both of these topics. We think that it's important to talk about the intersection of mental health within the AAPI community, and we're excited to do that with you guys today. Just a couple of housekeeping rules. Today's mental health virtual fair will be recorded, and we ask that participants remain muted throughout the presentations and either ask questions by typing in the chat whenever you'd like to, or unmute yourself and ask during the respective Q&A sessions. Everything that will be linked or mentioned today will be emailed to you after today's events. So just to introduce both of our organizations, again, my name is Monica Kua, and I'm the community outreach worker here at Chinatown Service Center. And Chinatown Service Center is one of the largest community-based Chinese American health organizations, health and human organizations in Southern California. So we offer services that ranges from social services, our services from our federally qualified health centers, which includes medical, dental, and behavioral health, which is where I work. We offer services for youths, and then we also offer economic development services. We are a multilingual and multicultural organization rooted in Los Angeles's Chinatown and San Gabriel Valley, where we host or help both of those populations.
And hi, everybody. My name is Deborah Niblick, and I am the Senior Librarian of Adult and Teen Services here at the Monterey Park Bruggemeyer Library. We're very excited to partner with Chinatown Service Center, as we've had a very fruitful partnership in the past in order to bring this series. Just kind of a little bit of a background, the Monterey Park Bruggemeyer Library actually received last year a grant to provide mental health programming, but unfortunately COVID actually got in the way of doing that, so we had to quickly pivot to bring some sessions online. But we're just really excited to be able to provide you with this important information, as mental health really is a health problem regardless of what folks say, and that it can be treated, and people can live very successful lives as long as they have the tools they need to live that successful life. And here at the library, we actually offer an amazing collection of resources in case you ever want to check anything out. We even have multimedia that can be checked out. Also at the library, we have children's, teens, adult services, which includes everything from story times to adult literacy programs, and even a passport program. I am very excited to say that the library has reopened by appointment only. So if you would like to come by and say hi, or to learn more about our services inside the library, you just go to our website, which is www.montereypark.ca.gov/library, and you can make an appointment to stop by. And I will go ahead and turn this over to Monica, and I hope everyone has a wonderful experience with this series. And at the end of this presentation, I will be leading the meditative painting activity. If you still haven't grabbed a kit and you're local, I would suggest that you just stop by a library, go and pick one up, and then we can start unwind from today's presentation with a little bit of art. So, okay, I'm going to pass it over to Monica.
Cool. Thanks, Deborah. All right. So for today's agenda, we have 3 presentations provided by providers here at Chinatown Service Center. And then at the end of the day, like Deborah said, we have the meditative painting grab and go kit, which you can still pick up from Monterey Park Bruggemeyer Library. And we have a little schedule change. Originally, we scheduled Introduction to CBT first, but today we'll be having Emotional Injury Matters presented by Nicole Chan. So To introduce Nicole, Nicole Chan is a multilingual, multicultural therapist who specializes in the treatment of anxiety, depression, insomnia, and other behavioral health symptoms. She has been in practice since 1995. She uses a variety of therapeutic approaches to bring rapid symptom relief to clients, restoring their normal functioning, productivity, and quality of life. Aside from her private practice, she works in Chinatown Service Center as a therapist and an outpatient clinical supervisor. So let me pull up her presentation and we can go ahead and get started.
Thank you, Monica. Can you see me? I love to meet all of you, but then if you can show your face, or, I would love to see that, because right now I am very, very excited. So excited that my heart is pumping. Okay. And I think it goes well with our topic today, my topic today about emotional health, emotional injury.
Oh,
well,
sorry, Nicole, your camera's not on yet.
Okay. So, all right. So I'm on now. Good to see you, everybody. If some of you want to, let me know who you are and how you look like. I love to have that, because I'm very good in talking to people, okay, face to face. But then when there's like a black screen, it makes it hard for me. So I'm just imagining you're there listening to me. So at the end of my presentation, I have some time for Q&A, so feel free to bring up your questions to me. So when we talk about health, normally people would think about, okay, so am I fit? How's my blood pressure? How's my temperature? Or during the COVID, of course, am I positive or negative? So that's a common theme that we are used to for this past year. However, if we think about it, okay, so we all care about our physical health. We want to be well, we want to live longer, we want to be fit, we look good. Physical appearance is really important. However, the way we take care of our emotional health, our feelings may not be the same, okay? So next slide. So let's explore. Let's start with the different types of physical injury that can start with a very minor one, like a paper cut, or something like maybe a bruise, or something more serious, some broken bones that need a cast, or sometimes, cramps, or some other physical problems. And what is the usual way that we take care of these physical injuries? Are by maybe simple as a Band-Aid. Even a 5-year-old child would know to get a Band-Aid, or maybe put some ointment, or take Tylenol if there's a headache or some kind of pain or ache. Or if we need more, then we go see a doctor. And ultimately, maybe we need to go to the hospital. So there are a series of treatment for physical injuries. And it's natural. And most of us, we know what to do. However, are you aware that we can also get injured emotionally? Let's talk about some of the emotional injury that we can easily get without even knowing. Well, one of the very predominant one is the isolation and the loneliness we feel during the pandemic. We are, some issue happen too with, like, when people are staying in one household, the family members who used to go out to work every day, go to school, or go to, only meet for a certain time during the day. Now we're all crammed together. Guess what? Sometimes there are conflicts, sometimes there's difficulties with personalities, and conflict happens. Or sometimes we are so caught up with our own issue, we ignore to say hi to our family members or kind of like carry a long face. And these can easily create emotional injury. And unfortunately, there are people who also lost family members, who lost loved ones. And that sense of sadness, that sense of loss, is also a kind of emotional injury, just like, someone got a cut. If someone got fired, or something happens at work, or in school, or outside of home, or even at home. And you can think about these kind of situations. These are life events, life happenings that we all experience. But are we usually aware of the emotional hurt? Are we usually aware that, I got emotionally injured? Probably not. But if you think about a simple paper cut will cause people to feel painful and hurt. Think about when you lost a loved one, when you lost a job, or when you lost a friendship. There's the emotional injury. And sometimes it's not just that type of situation. Sometimes emotional injury happens just so quickly. Let's say you have a good friend that you've known for years, and then you see this friend, he's coming your way, and you're ready to greet him, say hi to him. And then when you're ready to do that, your friend turned his head away and walked the other way. What do you feel? Are your feelings hurt? So an emotional injury can happen very quickly. Someone say things in a different tone, such as, if people ask you, have you eaten yet? Which is common in the Asian or Chinese culture, where the older generation would say, okay, because asking if you have eaten is a way of showing love and concern. But just by that simple sentence, have you eaten yet? In this tone, or have you eaten yet? In a kind of condemnatory tone, or have you eaten yet? That's kind of, so all different kinds of situations may contribute to different kinds of emotional responses. So let's look at what are some of these emotions that we frequently experience, but don't really talk about. Next slide, please. All right, I have here a list of different kinds of emotions. You can take a look and find out if there are any. Loved, relaxed, these are the good ones. Sad, anxious, grateful, hopeful, jealous, numb, hurt, confused, annoyed, and then many other ones. I would not say that they are the bad ones, because emotions actually are important for all of us. If we don't feel sad when something hurtful happens, or we lost a loved one, we are kind of like, we'll wonder, what's going on with us, because the inability to feel emotions is very, very bad, because sometimes, people, when they don't have the ability of feeling emotions, they become kind of like psychopath, sociopath type of situations. That's really, really unhealthy. So being able to feel a variety of emotions is extremely important for all of us. However, we tend to avoid the feelings of those unpleasant ones, which are like sadness, anxious, or Not yet. Let's go back. Anxious, angry, disappointment. These are essential and important emotions that we need to recognize, we need to acknowledge. Just like, if I lost my job, I feel very, very sad. Or if I lost a friendship, I will feel hurt. If a friend betrayed me, feeling hurt is part of the natural process. Without the ability to acknowledge this and just kind of like brush it aside, it's kind of like, oh, okay, so like you have a cut, you have an injury, but you ignore it. You tell yourself, oh, no big deal. So what's gonna happen if you continue to think like that? Continue to, because in life there are constantly situations that may trigger different kind of emotions. People get anxious. I see a lot of clients who are very anxious. They get anxious because they could be like, because of some thoughts, that's nonstop rumination of negative thoughts. They get anxious. When they don't know how to manage that anxiety, it turns into other things, which I will talk about later on. Okay, so of course, we all love to feel loved, relaxed, calm, satisfied. However, at the same time, if we don't know how to regulate those so-called unpleasant emotions, we will never be able to fully feel those positive emotions. So I see them as something that's related. And then let's look at what happens when we fail to acknowledge and regulate the unpleasant emotions. They will turn into the next situation. All right, so emotional injury requires treatment and healing too. Okay, so when we don't take care of these emotional injuries, they will turn into trash in our body, in our mindset. Okay, unregulated emotions turn into emotional trash. Think about, when you constantly live around these unhappy emotions, it's like living among trash. What would you like? I mean, if you prefer, in normal life, imagine you live in a household full of trash. How is your life going to be? What kind of situation, what kind of symptoms will occur? Will you be happy? Will you be able to fully function to your best? Or some of these, when we live, some of my clients, they don't, they have carried a lot of, distress over the years, unresolved trauma that trigger emotions that are very, very difficult for them. So when you live in this kind of environment, guess what happens? It's going to take a toll on your body and your cognition. Next slide, please. So let's look at some of the symptoms that got triggered by our emotional injuries. In my practice, I see a lot of clients who came in reporting insomnia, poor sleep, nightmares, or only maybe sleeping a few hours, 2-3 hours a day. And then maybe also difficulty falling or staying asleep. And when I see them, usually they've been checked by the medical doctor to find no other, they've been given sleeping pills, but it seems like it's not working. So why is it so? And upon my talk with the client, my discussion with the client, usually they will tell me about things in their lives that cause them to feel anxious or depressed or sad or angry, a lot of emotions that's actually going on in their life. And mind you, in order for anyone to sleep well, we have to have a sense of security. We gotta feel safe. Because if not, it's really hard to fall asleep and stay asleep. Think about in the animal kingdom, you see these animals, they don't really sleep long because they have to be on guard for safety. And we are, also the top on the animal kingdom. We also carry that need to feel safe in order for us to rest and sleep well. So frequently people come to me wanting help with their sleep. But I see that as actually as a symptom, as a signal, saying that something is wrong that's taken away this person's mind of peace of mind and sense of security. So other symptoms that got triggered by emotional injuries could also be like, when you're not sleeping well, your memories got affected. Your judgment, your attention level got affected. And then naturally, it will affect one's judgment and productivity. And let's also look at some of the physiological issues that got triggered. Many of the clients that come in to see me, they report headache, pain, or neck pain, or shoulder pain, back pain. As it's interesting, when I ask them to talk about some pleasant memories in their life, some of the happy moments in their life, I ask them, do you feel your pain? They say, no, I don't have any pain. So from my clinical experience, I see a lot of people that, the pain actually came from the unresolved emotions, the unresolved hurt, unresolved anger or fear. So there is, I'm not going into that, there's a lot of physiological reactions when, just like when people feel strong, especially fear or anxiety, their heart beats fast. Maybe they have dry mouth, maybe they have stomach problem. But then when you are not treating or you're not understanding these dynamic and just treat the symptom, treat the stomach upset, it may help with the medicine temporarily, but not in the long run. So I see a lot of pain that's related to emotions. I see a lot of people who ultimately develop, because when your body is constantly under stress, straining, it's going to hurt the body. So cardiac problem, diabetes is also very much related to, I'm not expert on that area, but when people are not sleeping well, it does change the blood sugar level. And then cancer ultimately, okay? So it's so important that we do have to have the concept, we have to understanding that you no longer just treat, okay, if it's headache, you treat the head. No longer like that. You have stomach cramp, okay, you just take care of the stomach. Because if you understand the human physiology, the stomach is called a second emotion center, meaning it's extremely sensitive to our mood, our emotions. So, okay, so these are the physiological and cognitive issues. Let's look at the next slide. So the insomnia, which I talked about, and then the chronic pain, okay, so and then memory loss, cardiac issues. And then there are a lot of clients that I've seen that they kind of fixated on their physical symptoms. However, when they have been checked by all different specialists, cardiologists, neurologists, GI doctor, all different kinds of specialists, to find no reason, very likely is their emotional turmoil that they are not aware of. That is causing all this physical distress. So I strongly encourage you to take a look at your emotional health and learn about this important part of you. A metaphor I like to use is that, when we eat food, okay, we eat food, our body process, digest, absorb, and then we'll excrete whatever the waste, okay? So we're having regular bowel movement is essential. But if you think about the emotions that we experience day in, day out, we just absorb, and we don't have the healthy way to let it out. It's gonna stuck inside us. And then people may get, very depressed, or may get into kind of like spiral into really, really difficult situations, like, severe mental illness, paranoia, schizophrenia, and then also, aside from the genetic component of it, sometimes people do, develop into those kind of mental illnesses because of not knowing how to vent, how to get rid of the emotional trash. And then from a sociological and interpersonal aspect, there are constantly, if you can see the news, a lot of these murders or killings or very, very, crimes. Frequently, a lot of those who are in prison are actually mentally ill. They actually need help to learn how to regulate their emotions healthily. So these are the situations. These are the problems. What can we do? What are the options? There is options. There is help. Okay, next slide, please. Okay, so some of the suggestions, when we deal with emotional health, emotional injuries, okay, I would recommend look for individual counseling. If we have the sense that we have physical injuries, we go get help, then individual counseling is just also a way to get help when you're emotionally injured. Don't carry any kind of stigma about it. I know people still think about, oh, no, I'm not crazy. Why am I going to see a shrink or a therapist? No. Okay, that's not the case. Be kind to yourself. Be kind to yourself and get the right kind of help. If you have been told by many doctors that they can't find any reason for your pain or for your whatever distress, maybe there's an emotional component to it. Okay, so individual counseling or medication-assisted treatment, that's usually done by a nurse practitioner or a psychiatrist, and also group therapy. So in our agency, we are doing a pilot group, which is one of the groups that I will that our company is doing is a group on emotional health matters. And I will, next slide. Okay, so this is a group specifically about emotional health. And then we don't have a date set yet, but then we have some of these information. And hopefully, by the end of this group therapy session, you will be able to identify and name various emotions, the physical manifestations and impact on health. And secondly, to learn and practice effective emotional regulation techniques so that your resilience and coping will be maximized. Thank you very much. If you have any questions, please let me know. Oh, also if you are interested to know more, please, let us know through this link.
If anybody has any questions for Nicole, you can go ahead and type it in the chat, or you can unmute yourself and ask her yourself. Feel free to do so anytime. All right. If there's any questions you might have later on, you can go ahead and email us with the information we'll provide at the end of the presentation. So once again, thanks so much, Nicole, for presenting about that topic. Yeah.
Bye, everybody.
Thank you. We're going to go ahead and start the next presentation. So the next presentation will be by Chanmei Lam, and the topic is Introduction to CBT. Oh, I see we have a general question. It asks, are you going to cover what to do about specific social issues right now, such as the hate crimes on Asians? So unfortunately, that's not on the docket for today, but our agency, Chinatown Service Center, did just have a presentation on racism and COVID-19 and sort of the topics you were asking about. So if you want to email one of us individually, or I can provide my email at the end, I can provide some resources if you're looking for that. But thanks for bringing that up. All right, so we're going to go ahead and start the next presentation. Let me go ahead and... All right, so next we have Introduction to Cognitive Behavioral Therapy with Chanmei Lam. Chanmei Lam is a licensed clinical social worker. She works as a clinical outpatient supervisor here at Chinatown Service Center. She received her master's degree in social welfare from UCLA. She has 10 years of postgraduate experience in the mental health field, treating depression, anxiety, trauma-related symptoms, and severe mental illness. She has been motivated to be in this field by her personal experience and family's experience with mental health conditions. So I'm going to go ahead and share her presentation. Sorry. All right.
All right, good morning, everyone. Is my volume okay, Monica? Great, okay. So good morning, my name's Chanmei Lam, and I'm here today to talk with you all about how we can achieve mental health and wellness through cognitive behavioral therapy. I'm going to start with a little bit of introduction about myself and to just add a little to what Monica has already shared. If you could go to the next slide. As Monica mentioned, I do work at Chinatown Service Center. While my official role there is a supervisor, I do carry caseload and see clients one-on-one and work with a lot of wonderful colleagues, Nicole being one who you just saw, and you're going to see some other folks later today and possibly next week. I do want to share that, my journey and interest in this field is definitely motivated by my own personal experience with depression and anxiety, panic attacks, and my family's members' experiences with mental health issues as well, which also have included depression and anxiety, among other things. And I really want to share that because, I know it is definitely not something that we talk about enough in our communities, whether that's the Chinese community, Asian American community, in communities of color. There is a lot of shame and stigma around it. And so, it is quite a common thing that many of us experience. And even though it is not something that we talk about, it does still exist. So feel free, to type in any questions or comments throughout the chat. I'll try to, share, information that's sort of relevant and maybe tie in some of my own personal experiences as well, to make some of this information more, relevant and personal for everyone too. All right, go ahead to the next slide. Yeah, so I just want to talk a little bit about what is therapy. If you haven't had any experience before with therapy, it might sort of be, it might sort of be a mystery to you. We all have certain preconceived notions on what that might look like, right? From TV shows or movies, image of someone laying down on a couch and somebody psychoanalyzing them. So what therapy really is that it's a private and confidential meeting that you get to have with a professional therapist, such as myself or my colleagues. This can often happen in a one-on-one situation or in a group situation. It's really a time where you get to, have some me time, where it's a safe place for you to express yourself to someone who is understanding, non-judgmental, and really is there to actively listen to what you're going through. It's also a good time to reflect on what your needs might be, or to identify what your needs might be, and learn through the process of therapy of how to meet your own needs or how to get those needs met. It's, and this is, I think, something that a lot of us don't have in our lives these days, whether it's because life is very busy and we may be juggling, work or family, children, caring for others, right? Or perhaps we don't have any privacy, especially given this current pandemic situation. We may not have our own space to really separate from all that's going on, to engage in this kind of reflection. So therapy can be very helpful for that. It's also a really flexible process. Most of the time, people think that they're coming into therapy and perhaps they're going to be talking and the therapist tells them, what's wrong with them or what to do or gives them advice. And, there is talking, but really the therapist is there to guide you in your journey. We're sort of a passenger in your journey. And we do use talking, to explore and find out where you want to go and help you get there. But a lot of times we integrate other modalities, such as art and movement. These are modalities that are really, really helpful in helping our brain and our body really process the stress and trauma that we might be experiencing at different levels. And I know later on today there's a art activity planned, which I'm really excited for all of you to experience. So hopefully you'll stick around and participate in that. Okay, next slide, please. All right, so why go to therapy, right? There's so many good reasons why one can go to therapy. It is something that can help you manage any stress that you might be going on. And, who doesn't have stress these days, especially, with our current situation. It can help you adjust to change and life transitions. And change could be something like the pandemic. Change could also be something positive, like graduating high school and going on to college, right? So whenever there is a change, it does bring up a lot of stress in our bodies. And once in a while, it's okay to have some of those stress hormones and chemicals, but if we're experiencing it chronically, it can make things difficult for us. Earlier in the chat, I saw that, someone mentioned what's been going on with the hate crimes against Asians and Asian Americans. That is certainly not a change, but definitely a stressor, right? And as we are exposed to information about that, whether it's through news media or stories that we may hear from, friends and family, that is definitely having a psychological impact on us. And it can feel overwhelming at times. And so therapy can be helpful in figuring out a way to manage some of the emotions that are being triggered by that. And to also figure out how can you still achieve a sense of safety and peace, and how to find your own sense of empowerment even throughout this time. Therapy can be really helpful to address burnout, whether that is from school, work, caring for others. It can help you address behaviors, beliefs, feelings, any physical symptoms that you might see as a problem, from your perspective, right? It can help decrease anxiety and depression. It can also help you do more of what you love. Sometimes we get so focused on, doing things that can be seen as productive, that we forget to engage in things that are also enjoyable, that bring us a sense of joy. And when we don't have that, balance, that is when we might see some depression or anxiety come up. Sometimes when we're overwhelmed, it can be hard to work towards life goals that we really want to work towards. So therapy is also a good place to help you make movement towards that. Overall, it is really a great space to help one improve different areas of life and health, whether that's school, work, relationships. I get lots of clients who come in with relationship issues or difficulty with family members. As a child of immigrant parents, I know that struggle very well. There are generational differences, and there can be a lot of sort of different expectations that they may have versus the reality that we might be experiencing in the world. And sometimes that can cause some internal stress. And so therapy is a good place to work through that. And finally, we all have some form of grief and trauma that, we've experienced throughout life. Even if you've never lost anyone, just through the pandemic itself, you've experienced a loss of what, used to be the norm, perhaps a loss of daily routine or maybe a job, that is something that we are all collectively going through right now. And, it's therapy can be a good place, for you to unpack some of that, maybe take care of some of those issues with someone so that you don't have to go through it alone. Next slide, please. So who can attend therapy? Really anybody can. So I work with children, teenagers, adults, older adults, people of all different races and ethnicities. Since we are, located in Alhambra and Chinatown, we see a large number of Chinese and Asian American clients, but certainly a lot of Latino, African American, and Caucasian clients as well. I listed out some of the kinds of people that I see in my office, and also people from my personal life who I know are receiving therapy. So students, school teachers, librarians, music teachers, legal staff, medical staff, dental staff, had engineers, social workers, actors, artists, activists, college professors, parents, caregivers, food service workers, retail workers. I should actually also add therapists to that, because therapists have their own therapy as well. I certainly do, and many of my colleagues and friends do as well. So it is really, it's not something that you can only attend if you're having, extremely serious problems, but a lot of people who attend, fall into these categories. So next slide. Okay, so I wanted to talk a little bit about when to seek therapy. A good time to seek therapy is when you're not feeling quite like yourself. Perhaps you're feeling more sad or down or unhappy. You're finding that you're not caring about the things that you usually enjoy or are really interested in. You might be spending less time with friends or loved ones. Perhaps you're leaving home less than you normally would, and just not being engaged as as you would have been in previous hobbies or interests. So really it's, if you start to notice that either you or someone else is having some of these changes, it might be a good idea, to think about this idea of attending therapy for yourself or others. Next slide. Sometimes we may also have a lot of negative thoughts about ourselves or negative self-beliefs. We might think that, we just don't have any idea of what's going on or what we should do. We're comparing ourselves negatively to other people. Other people seem like they've really got it together, or they have what we don't have, and we're just not in a good place. That's also a good time to engage in therapy. To explore some of those negative thoughts, and also to help you figure out how you can get to where you want to go. Next slide. And so here I just listed some common symptoms of depression, just so that you can become more aware of it. And again, if you have any sort of questions about this as I'm going through the slides, feel free to drop a question in the chat and I can answer it as we go along. But these are the common symptoms of depression. And you don't need to have all of them. You just sort of need to have maybe more than half or so. And if you're having this, most of the time for at least 2 weeks, and it's making some things difficult for you in terms of your functioning, it's a sign that you might be experiencing some depression symptoms. I get a lot of clients who think that depression means you're in bed and unable to get out of bed to do your daily routine. That's not true. You could look fairly functional and still have some depression symptoms. So, and there are ways to address this. Luckily, there's lots of different, very effective treatments and ways of healing from depression. So this is not something one needs to, suffer with on their own. Okay, next slide. Another time to seek therapy is if you are finding yourself just overwhelmed with worries or negative thoughts, right? I know that we all experience this to some extent or another, but sometimes there's a lot of it and it really, really gets in the way. So if you're feeling overwhelmed by worries, that's a good time. Mm-hmm. And sometimes when we're so overwhelmed, we think about all that we have to do, whether that's work or household work, or what we need to do, for our family, that it drives us to avoid it or to maybe procrastinate. And that can be one way that we're trying to cope with the situation. But as you know, it's sort of, it only means that that pile just keeps growing larger and larger, right? So I know I have these days, definitely from time to time where, I'm laying down and thinking about all that I need to do. And that's okay, that's normal. But if you're finding that that happens a lot for you, it might be a sign that it's, time to reach out. And sometimes when we are stuck in this negative loop, we start to feel really powerless or guilty. And then those become, really difficult emotions for us to manage. And so it can be hard to get unstuck from a negative loop on your own. And if you're feeling that way, it can be helpful to have someone, help you figure out how can you disrupt that loop, because it can be done, but sometimes I know it can feel hard. So here I listed some typical symptoms of anxiety. And so you can see them on your screen, so I won't list them out. But again, you don't need to have all of these. If you have, someone has most of them and they're happening most of the time, to officially get a diagnosis of anxiety, one would have been feeling this for more than 6 months. But honestly, if it's, if you've been experiencing this for even a shorter time, it's always good to, check in, because you don't have to wait until it's really bad before you reach out. Just like how Nicole was discussing in her presentation, right? With physical injuries, we don't always have to wait until it gets really bad before we go to see a doctor. Sometimes if we intervene early, and maybe we do put that Band-Aid or ointment on, perhaps it won't get worse. Or, if we do take some medication, we don't end up needing to have to go to the hospital. Same thing for, mental health. Sometimes we can do a little bit of preventative care, and it can help it from getting much worse. Next slide. Okay, so I want to share a little bit about a group that we are, also going to be running at CSE. So, there's many different kinds of therapy, and most of the time at our agency, we do one-on-one individual therapy, but we are also wanting to offer the community some group therapy. And I've done both before, and I just want to say that, it is one thing to have a therapist and have that personal space, and for someone like me to give you feedback and encouragement, and I think that that's a very helpful part of the healing process. But I've run therapy groups, and I just have to say that sometimes there's this magic that happens in the group space that you cannot get just with me. There's something about, hearing others' stories and feeling connected to their stories. And then also having a group of people giving each other positive feedback and encouragement, perhaps things that we might not be getting from our own family or friends. And there's some real magic to that I can't quite describe with words. You have to sort of experience it. And, honestly, even as I'm talking about it now, and I'm remembering some of facilitating some of these groups, and I'm sort of getting, some chills and shivers, because, it really can be very, very powerful. It's a very powerful healing process. In our society these days, we spend a lot of time perhaps being alone, or we've been socialized to think that we need to do things alone. But that's not necessarily true in many of our communities, whether that's Chinese, Asian, Latino, African American, or all communities. We've, there have been cultural norms where we come together as a community to find healing. And I think that really is also seen in the power of therapy groups as well. So I want to tell you just a little bit about cognitive behavioral therapy and what you could expect from attending this group, which is something I would be facilitating or possibly co-facilitating with someone else. So go ahead, Monica. All right. So the idea behind cognitive behavioral therapy is that our thoughts, our feelings, and our behaviors are all connected, as you can see in this image. So our thoughts can affect our feelings can affect our behaviors, and our behaviors can affect our thoughts. So one example of that could be, if I were going to, let's say I had to go to some kind of like party, although who's going to parties these days, I'm not sure. And let's say I was feeling a bit nervous, right? And if I'm feeling nervous, perhaps one of my thoughts is, oh, like everyone's going to be looking at me and looking at what I'm wearing. So that might be a thought I'm having, right? And they're going to think there's something wrong with me. And so when I get to the party, right, what will my behavior be like? My behavior might be that I don't really interact with anybody. Perhaps I stay to myself. And then unfortunately, that becomes a self-fulfilling prophecy where because I'm staying away from people, then people aren't talking to me. And that might reinforce me in feeling nervous and anxious. And then so that's negatively reinforcing my thought of like saying, see, there is something wrong with me. There must be something wrong with how I'm dressed or looking. That's why no one's talking to me or approaching me. So there's this sort of negative feedback loop that happens. And I can give so many other examples. You all might be able to think of some of your own examples too. So what CBT does is that we work on changing some of this, we work on changing some of the thoughts and behaviors that are connected to our feelings. It's quite hard for us to change our feelings or mood, right? If I said, hey, don't feel so down, like just be happy, just forget about those worries, just relax. That's really hard to do. We're not like a light switch where we can just turn off certain feelings and turn on other ones. But our thoughts and our behaviors are a little bit more malleable. We can actually work on changing some of those. And I do want to say that, this doesn't mean that there's something wrong with the way that you're thinking. A lot of times we may have negative thoughts about ourselves or others based on our previous experiences. So our thoughts may make sense given our experiences, right? So for example, even if we take something like the situation on hate crimes against Asian Americans, a thought that we might have is that it's unsafe to go outside, right? That's some of the thoughts that people in our community or elders may be having. It's unsafe to go outside. I need to stay home, right? That's their behavior. And so it does make sense. But if it ends up being a negative loop that you don't like, we can take a look at that and see what you can do differently, right? So perhaps the behavior doesn't have to be isolating at home due to fear of being harmed, right? But it can be perhaps we find a way to go into the community with others to keep, keeping each other safe together. Perhaps we can take different political actions to help ourselves feel empowered, right? Perhaps we can engage in conversation with people from different communities, and that may change our feeling, right? Instead of feeling fearful in that sense, we may then feel more empowered or connected or strong, right? And then that in turn will change our thoughts. So I just wanted to put that out there because sometimes when we talk about the idea of changing thoughts, it can make it seem as if, as if there's something wrong, but there isn't. Okay, next slide. So this is just a little snapshot to kind of show what typically happens. Usually there's an event that triggers, some of our thoughts and beliefs, and then it triggers certain consequences such as our feelings and emotions and behaviors. So in a CBT group, we would really be looking at this together as a group each week and sort of trying to find places where we could intervene in this process. And we would be working on trying to take a look at thoughts that might be very negative or unbalanced about ourselves. So sometimes we might think that, there's something wrong with me, or I'm not good enough, or, I have to overwork, I have to overperform. And we find ways to balance that out a little bit more. Next slide. And we can balance it out by creating more accurate thoughts that can be healthy. So you can develop an increased awareness of harmful thoughts and then develop healthier thoughts about yourself. Next slide. We also focus on changing some behaviors. So I gave a little bit of an example of that earlier, but really a big part of this will be about how to do more of what matters to you. Because the more that you do what matters to you, what's meaningful to you, what's enjoyable to you, you will start to feel better. But I know sometimes it can be hard to take those steps. So we will work on that in the group of how do you actually take those steps, so that you have a positive feedback loop for yourself. Next slide. And I do want to mention that sometimes we think that the path to success is a linear process, where it's just easy and straightforward, and that's really not the case. It looks a little bit more like the picture on the right. It's sort of step by step, but it can feel quite messy, and that's a normal process, both for therapy and for life. And the group would also focus on helping you to improve relationships. because if one is feeling stressed, depressed, or anxious, it can often interfere with our communication and how we interact with others. Next slide. And so in the group, we talk about different kinds of communication styles, whether one is passive and we tend to prioritize other people's needs and we disrespect ourselves in the process, or if we're too aggressive sometimes and you prioritize your needs, but you disrespect others. Sometimes this can, cause problems. And there may be good reason why you have those communication styles, but perhaps they are no longer serving you well. So we work on trying to find the middle ground of being assertive, where you can balance your needs and other people's needs and respect both parties. Okay, so that's a basic overview of what we would be covering in group. The group will be a 12 to 16 week session. I haven't quite decided on that yet, but it'll meet weekly. And I'm going to cap it at 8 participants. And I guess if you're interested, or if you know people who would be interested, the only requirement is I would like for you to be open-minded as you come into the space. It's going to be 1.5 to 2 hours. It'll be in English. And we do take various forms of Medi-Cal insurance and Medi-Medi, which I've listed there. If you don't have these insurances, we do also take, we have a sliding scale fee that we can use. Okay, and so my name and information is here. Monica's information is here, and I know she's going to stay around after this presentation. If you're interested in the CBT group, or actually in any of the groups today, you can use that link that's there on the slide. And you can also, I believe they will also give that information again at the end of the day. And I think this is the last slide. Yep. So just want to check and see if there's any questions that you all might have. Feel free to drop something into the chat.
So there is a question about whether these will be in-person or online group sessions.
Mm-hmm. Yeah, so I think we are not sure at the moment. It might depend on how much interest there is, and if we don't have any interest for a while, the groups might start later, so we might be doing them in person. But if there's a lot of interest, sooner, and we are not ready yet to have them in person, they will likely be online. So that's still up in the air, but that's a good question. Yeah.
And then another question is, are these sessions limited to people living in Monterey Park?
I don't think so, right? For us as an agency, we service the San Gabriel Valley area. So we also have an office, in Chinatown. So I know that it's probably open to LA City as well, right?
Mm-hmm.
Mm-hmm. Great questions.
All right, I'm gonna pull up the next PowerPoint, but thank you, Chun-Mei, for presenting. And if you guys have any more questions for her or for Chinatown Service Center in general. Oh, there was one more question. How do you keep confidentiality in these sessions?
Mm-hmm. So in a group setting, we talk about this as a group in the beginning, and we do have group guidelines, and it is up to, we ask that each person maintain confidentiality by not sharing information that's discussed in a group. So it is a group contract, like a group rule that we have to, create and agree with one another on, because that's something that we're always concerned about. I do want to say that in all the years that I've facilitated therapy groups, I've not yet had that come up as a problem or issue. I think that when people come into a group, they want their own information to be private. And so out of that, they do respect the privacy of everyone else. We do have to build that trust. Yeah.
Awesome. Thanks for the questions.
Okay, I see one here. It says, do all therapies charge a fee? I think that if you have insurance, if you have like Medi-Cal insurance, or if maybe you have private insurance, if you go through your insurance, you usually do not have to pay a fee. Sometimes there are people or places like us where we may also, we know that some people don't have insurance for different reasons. So we will use a sliding scale fee. We match it to how much income you make, and we determine a fee that hopefully works for you. There are therapists out there who, from time to time, they may decide to provide pro bono fee, whether they're in private practice or they might be, in some kind of community setting. So it really does depend, but that's a good question. There are a lot of affordable services out there. So if you're not able to find it, reach out to us. We can probably help you look into that. Okay.
Thank you, Chun-Mei.
Thank you, everyone. Take care, stay safe, and hopefully we'll see you at some point. All right, take care.
Thank you. All right, everyone. We're going to move on to the next presentation, which will be relaxation and health promotion with, oh, hold on. Sorry, the Zoom share. There we go. Our next presentation will be relaxation and health promotion with Jennifer Yu, who is our psychiatric mental health nurse practitioner on staff. Jennifer is a graduate of the University of Colorado, Denver. She holds a master's degree in nursing and specialized in psychiatric mental health as a nurse practitioner. She has over 10 years of nursing experience working with clients within the mental health specialty with a variety of mood disorders. So Jennifer, if you want to start your camera, and then give me a second to pull up your PowerPoint. All right.
Okay, thank you, Monica, for that introduction. And thank you to everyone else here that's taking the time to really listen in and learn more about CSC and the groups that we're going to offer for everyone. Starting off, I'd like to mention that, for all of these presentations, I feel like they're really interrelated to one another. And I feel like the ordering of the presentations was actually really good, because a lot of what I'm going to kind of discuss kind of relates and intermingles with what Chun-Mei and Nicole have both presented. So this particular group is focusing more on the relaxation part of skill sets for reducing anxiety and stress, and promoting overall wellness for mental health and physical wellness. Next slide, please. Yeah. So first off, how would you describe a relaxation or an environment of wanting to go into a state of ease? This group will definitely help a lot of people that are interested in finding a safe place to sort of practice and learn relaxation techniques or skill sets for better mental health well-being. And when we say well-being, it really encompasses not just the emotional and the thinking part of your health, but also the physiological. Remember how Nicole mentioned the physiological symptoms you can start having if you have a lot of stress and a lot of anxiety. And many times people don't realize these physiological changes are happening to them. They are so focused on just their inner dis-ease. If you really think about the word disease, if you really separate it, it's the first part is this, and the second part is ease. And ease is the state of being relaxed and being at a good state of mind. And this means not, it means no. So if you put the two words together, it means that your body is not at ease. That's what that means. And that's where disease comes from. So it's very important to kind of be in sync with your body and to understand where is this dis-ease of state of mind coming from. And so we try to make that safe place for you to kind of practice and to sort of learn more about how your body is reacting to this life stress that everybody experiences on a daily basis. Next slide, please. And so what are relaxation techniques? A lot of people may think, oh, you know, it's probably just deep breathing or just learning how to not think about stress. But if you really go more in detail about a lot of these different techniques, it really helps to sort of not only psychological reduce tension and stress, but also it's in conjunction with reducing the physiological symptoms of stress and tension. So for instance, a lot of you probably already know that physiological symptoms of stress may inhibit something or exhibit such as heart palpitations, you know, rapid breathing. There may be a lot of muscle tension. A lot of people may have headaches, maybe tension migraines. Some people may have chronic illnesses that stemmed from chronic anxiety. And some of these examples may include something like hypertension from so much stress all the time on a chronic level. And even eating disorders or stress from eating from which is not balanced, such as diabetes can also result from chronic, not so healthy eating patterns. Some people may have acute symptoms, which is not so much of a disease. For instance, like just sweating or trembling or being very nervous or just not feeling okay in inner-wise. And over time, if these conditions start to continue and never stop and it becomes a chronic issue, it turns into a disease in the body, which could be the high blood pressure, diabetes, and other sorts of, even cancer. I feel like some people have researched out there that chronic stress and chronic anxiety and other issues psychologically can turn into very, very serious illnesses later in life. So it's really important to sort of get a hold of the ways that you can really help yourself cope with the levels of stress and anxiety in your daily life. And it's a daily habitual practice. It's not a once in a month type of thing. It's a habitual practice that you need to do on a consistent basis for you to help regulate the stress in your life. And of course, psychological stress can be very much so, look very much like this physiological stress, meaning that there's a lot of uneasiness going on in your mind or in your state of thinking, a lot of anxiety, a lot of worrying. And remember, Chun Mei listed some of those symptoms for depression and anxiety. Those are very good symptoms that you can kind of look for to see if that's, you know, becoming a very habit on your daily thinking. And if it gets to a point where it's very severe, it can very much so turn into a physiological stress where you can really feel the physical tension of anxiety. And so these relaxation techniques that you may learn in the group can help you to sort of manage those symptoms so that it's not as severe. And possibly for some of you, maybe those symptoms may go away for a temporary amount of time. And then there's also another area that also kind of affects how stress is living inside us is our behaviors. Why do we act in such a way? And, you know, sometimes you're so stressed out or so anxious that it may inhibit you from acting in a certain way or expressing yourself in a way that you would like to, but it sort of prevents yourself from acting or behaving in that certain way. So these are all things that definitely interrelate with the other presentation about CBT, but also in this group too, just for the relaxation group. But this group primarily will focus on reducing sort of the physiological manifestations of anxiety and stress and tension in the body. Okay, next slide, please. So the next one, so this is talking about why are they so important then, right? So I talked a little bit about that already, but it is just important to always keep in mind that stress levels at some point for everyone is a normal occurrence, but we want to make sure that it is occurring at a lower or minimal level rather than higher for over a higher quality of life and overall better functioning of both the mind and body, right? So for example, some benefits of learning some of these techniques or just practicing on a general basis or just attending these groups. And you don't have to learn to do it perfectly on your own. You can come to group and just practice just within the group. That would be fine too. But some of the benefits would be having overall increased energy because now you're experiencing decreased stress or decreased anxiety, right? Reduction of anxiety. Maybe having better sleep patterns, maybe having better sleep quality, or not having any sleep problems in general due to feeling more relaxation during your day, having less fatigue, you know, having more higher energy as we talked about before. And then sometimes in some cases, if your anxiety or stress is mild enough that you can really see the maximum benefit from groups, it could result in increased self-confidence, feeling better about yourself, having more positive thoughts. And of course, this all depends on your severity level for your stress and tension and how long you've been struggling with it. But for temporary skill sets and for techniques, this group is really good for all of these benefits. Next slide, please. So who should take this course or this group? It really is open to, you know, anyone who is suffering from chronic or acute anxiety or stress or tension. It doesn't have to be that you have to have a clinical diagnosis or not. It doesn't matter. It's open to anyone that may be suffering from, you know, a really grieving incident that might have happened and you're really stressing out or you're feeling burned out from certain things and you need a space, a safe space to sort of open up and just relax and just have that time, just that brief moment in time during your day where you can unwind and really just really feel it at the core of your being of that relaxation. And, you know, of course, if you're struggling with anxiety, you know, on a chronic level where it's really becoming a hindrance to your day-to-day functioning in your life, this might be a good group for somebody like that to kind of get learn some of the skill sets. Next slide, please. And so some of the techniques that, you know, we might be going over in the group is, you know, this one's a very common one, deep breathing. And it's often very helpful to have an instructor sort of be there and guide you through this. You can try to do it, of course, by yourself at home later on after you learn it, but it's very different when you're in a group atmosphere and doing it as a group where you know that you're in a safe place and you're in a place where it's guided. We can do a lot of progressive muscle relaxation. And also that's also very nice to have an instructor kind of walk through that with you and give you instruction. Some of the other techniques we can use, it ranges from, you know, group coloring sessions to journaling. If this pandemic is over, maybe we can do some of the more involved ones, but sometimes, you know, we can go into like a group dance sessions, anything that is relaxing for a person that we try to kind of incorporate in the group that, you know, if we don't have any resistance to, we'll try to do that. And of course, everybody has different definitions to what they find relaxing too. So we also try to keep that into incorporation as well. So we always ask if, you know, before we start an activity, if you would find it relaxing, we'll just make sure everybody's on the same page about that. And I think number one is just having that safe environment to try to practice this in a really safe, confidential area where you know that you're just completely safe. So I think that's number one. Okay, next slide, please. Okay. And so from these groups, definitely what you can expect is that number one, you will be learning skills and techniques and skill sets for reduction in stress and tension. And also just know that you will be increasing a peaceful mindset in the body overall so that you won't have as much physiological symptoms of anxiety and stress. Once you reduce your mental health, anxiety and stress, it will translate into less issues physically. So hopefully, you know, some people may get relief from some pain that they may be having because their body is in a relaxed state now. Some people may have, you know, increase in just a better daily functioning and that they may feel better and that they're interacting with people more. They're able to eat better. They're able to concentrate better, all of those things that was previously mentioned from Chun Mei's presentation. And then also lowering stress overall in daily life and functioning. And like I said, some stress is very normal for probably all of us, but you just don't want it to be so high that it's becoming a detriment to your life and you can't function as much as you want. And feelings of overall better wellness, and wellness meaning everything from internal to physical, but also to just relationships and spirituality, anything else that is encompassing your life where you feel like you need to feel well. It's all interrelated together. So that's why it's so important to really focus on sometimes your unwellness. I'll get to the questions at the end. Thank you, Benson. I see your question. So overall wellness for a better, state of healthy mind and better body, okay? And there's gonna be, you will be learning a lot of consistency and practicing these techniques in the day-to-day life. So that's why I emphasize the importance of trying to attend groups on a consistent basis. But even if you do just attend one or two, that's totally fine. At least, at each session, you'll be getting something out of it. So that's what our focus is. Next slide, please. And so it'll be a weekly group, 1 to 2 hours. And the number of participants is unknown for right now, but we're trying to make it a good number, but not too big because we want it to be a relaxing, safe atmosphere. And must be over 18. And then the fees are, generally all of these insurances are accepted. Sliding fee is also accepted. And you should join if you feel that this might be of benefit to you in any way, in any, if you feel like any importance on relaxation in your life is important to you, that's something that you might want to consider. And you just want exposure to just even practicing just a few exercises, that would be totally fine. And just overall, always remember that, mental health is very much so correlated to your physical health. So you need to take care of it just as much as you take care of your physical health. Okay. Next slide, or I don't know if we, okay. So you can sign up using this, what is it? This link here. And I did see a few questions. Okay, thank you, Benson, for that compliment. And also, is it a different class or group from those mentioned by previous presenters? So yes, this is a different group from the previous presenters. And I know they're very, very interrelated, but the other groups that Nicole and Chun-Mei presented, they're focusing on different aspects of therapy. And this one is focusing just on relaxation techniques. Yeah, so that's it. Any more questions I can answer? Otherwise, that's it for this one.
Yeah, so if anyone has questions, you can go ahead and type it while we transition to our next activity. Thank you, Jennifer.
Okay.
All right. So we're gonna go ahead and start. All right. So if you had any more questions regarding the 3 group therapy sessions that Chinatown Service Center will be launching in the near future, we do have an interest form that you guys can fill out. The link is right there, so bit.ly/CSC group therapy. Any questions, you can go ahead and reach out to us. All right, so our next activity is the meditative painting activity, which will be led by Deborah at Monterey Park Bruggemeyer Library. We did have some grab and go kits available for pickup at the library, but if you didn't happen to pick one up, you can go ahead and follow along with anything you might have at home. So Deborah, you can take it away.
Actually, you know what, this might be a good time to take like maybe a 5-minute break. I do recommend that if you already have the instructions in front of you right now, you can go ahead and grab like a little plate, or if you have a little cup of water to clean your brushes, if you haven't gotten that yet, go ahead and take a couple minutes to get that, and we'll get started, let's say in about 5 minutes or so. Does that sound cool?
Okay, everybody, I guess we'll go ahead and get started since this presentation is supposed to go to 1. So it can take about that quickly, or it can take as long as you want to. You're more than welcome to share your cameras just so I can see your faces, or just so you can, if you want to, participate in this as a group. If you don't want to, that's totally okay. So as you can see with the kit, you should have received a vellum sheet, which is this real thick paper, 3 different types of brushes. You've got a little paint pot set, and if you have your cup and your water, go ahead and put that to the side. So before we start painting, there's a couple of things that I'd like us to do, which is to close our eyes and to kind of reflect on what it is that we're feeling in our bodies and in our minds, and kind of ask yourself a couple of questions. When we paint, do you need to release any tension, or do you need to bring something uplifting, energy into you? What exactly is going on? Kind of take stock of what you're feeling right now. Take a deep breath in, and whatever it is that you're feeling, you're going to use that energy to use as a vehicle to create this painting. Now, mind you, you don't have to be a professional. This is not a competition. This is just a method for you to kind of find that balance that you've been looking for. So if you had a stressful week, you might want to just release your tension by painting whatever that you're feeling. Or if you need something uplifting, create something fun and exciting. Pretty much just let your imagination go wild. So as you're thinking about that, go ahead. So right here we have 3 different paints. We have white, blue, and black. Now you can actually mix these to either make a light blue or a navy blue. You can even make a gray, or you can do all 3 and come up with the color that you want. So as you're looking through those colors, pick a brush. You should have a variety of different brushes. Pick the brush that speaks to you the most, and what exactly is your goal for this painting? Do you want, so say for example, do I want something wavy, or do I want something light, or do I want something a little bit chunky? Kind of figure out what appeals the most to you. And also, as you pick your brush, you can either dab it, you can either stroke with different colors, add squiggly lines or dots. If you want to make a Pollock, go for it. This is your time to do it. Oh, Benson, you've only got 2 brushes missing. Yeah, so you're gonna have a variety. If you didn't get an extra brush, my apologies. So just kind of work with what you got. If you've got supplies at home, go ahead and use those. So let's go ahead and get started. I'm actually going to go ahead and take my mixing plate, and then I'm going to use, this is my brush, it's a chunky brush, whatever appeals to you. Go ahead and wet it to thin out some of the paint, because it is acrylic paint, so it can be kind of thick. So I'm going to pour some out here onto my mixing plate, just like that. Actually, I'm going to pour all of it out, just like that. And then I'm going to take my other brush, and then I'm going to take this white. I'm feeling I need a little bit of uplifting today. So go ahead and pour that onto your mixing plate. Don't pour it onto your fingers like I'm doing right here. Perfect. And then go ahead and get some water, thin it out if you need to. It's just going to change the consistency by adding the water. So it's going to have a different texture. You don't have to add water. It's totally what you feel like doing. So because I want something a little bit uplifting, I'm going to take a little bit of this blue, like this. Go ahead and move this. And again, you don't have to choose these colors, whatever you feel speaks to you the most. And then I'm going to take some of this white, and I'm going to mix it in to create that light blue, because that's what I'd like. And there's a reason why I chose blues, because blues are emotive in many ways, from, just to release tension, or to just, this makes me happy, and it's pretty. So I'm going to go ahead, I'm going to move that. I'm going to take my blue with whatever brush that appeals to me. I'm just going to stab it. That's what I feel, just like that. You can do whatever it is that you want. Like that. Now, mind you, you don't have to use the entire sheet. You can just use part of it, because that could be part of the aesthetic. Here's some squiggly lines. That's what I'm gonna do. Oh my gosh, it looks like a creature from Monsters, Inc. But that's okay. Do squiggly lines, whatever speaks to you. But here's the thing, as you draw or you paint, just be mindful of how you're feeling. Are you feeling playful? Are you feeling angry? Are you just feeling tired or listless? Check in with your emotions, but also release them into your paintings. Just like that. Okay. I'm going to take some of this blue. I'm going to fill it in right here. So as you continue to paint, as I mentioned, what are you feeling? Take stock of what it is that you're feeling. And ask yourself a couple of questions. Do you need to release any sadness? Do you need to release any anger? Or are you just so excited to be painting because you haven't painted since you were a kid? The whole goal of this particular activity is not just to paint, but to kind of bring us back to center and to balance that energy. And you know what? I even got paint on my fingers. I'm going to do some finger painting. Why not? This is not meant to be a clean activity. And the best part about acrylic is that it comes off real easily. So if you get it on your clothing, it'll come right out. So, okay. And also, as you continue to paint with the different colors, I'm actually going to switch mine up. I want to see what adding black is going to do with my other paintbrush. I'm just going to paint. What is this going to do? How is this going to affect how I'm feeling? And then take a moment to see how it's affecting you. Is this something that you like? Is this what you're meaning to express? And if it's not something that you're meaning to express, take some water or bring a new color and mix that in. And also take a look at how quickly or slowly you're painting. What is this telling you? If you're looking for something that's to calm you down a little bit more, go slower. Wash that off. You know, and if you want to switch it up with different colors, go for it. I'm going to take this white and I'm going to bring back this. Oh, look at that. I just put water on it. I've got like a blue-gray. And mind you, I kind of had a tough week, so a lot of my brush strokes are very hard as I'm trying to release some tension. And as you paint, continue to check in on your feelings. And mind you, your feelings are not invalid in any way. They're real. And by expressing them in the best way you see fit, no one can tell you otherwise how to do it. How's everyone doing? Hopefully this is helping. And another tip as you're painting, oops, don't do that. Didn't mean for that to fall. Try and just focus on the painting and nothing else that may be distracting you. I'm gonna switch it up. Take some of this white. And also, if you were, if you've ever practiced any kind of meditation or any yoga, breathing helps too. So take those breaths in, as that will help you release some of the tension, but also bring in that positive energy that you need for today. Okay, Sherry. Yeah, do you have a question, Sherry? No, that was just my mouse. Okay. And I'm taking some of my water and I'm just putting it on here. What's great about this vellum paper is that it absorbs everything, but it won't bleed through. I think I might actually get around to covering this whole sheet.
I forgot my camera was off, but I just wanted to show everyone that I've been following along, but with markers instead.
Isn't this fun?
Yeah.
Like, you know what? Crafts are not just for kids.
Mm-hmm.
But if we can do it in a way that can bring some kind of solace or any kind of relief, it's a good thing, because we get so busy in our lives that we constantly forget to check in with how we're feeling, how we're doing. And it's important to take this time. So one thing about meditative painting, it's an amazing form of self-care that obviously it's not going to take time at all. You can take 15 minutes out to just doodle. You can take 20 minutes out. I'm just going to go ahead and bring this up. You can take like 20 minutes out of your day to just sit there, pull out some paints, take some paper, paint something. If you really want to, if you're very proud of what it is that you're creating, you can go ahead and put it on your fridge, or you can even frame it. But if that's not your intention, then that's okay. If it's something that you're just going to throw away, that's okay. But again, the importance is that you're using this as a tool to help you express yourself that is not only productive, but it's going to make you feel good. Because at the end of the day, this is what self-care is about, not only just feeling good, but helping us manage how we feel. So I actually think I've covered the whole thing. Look at that.
I'll show mine to you.
Yeah.
I wrote some words here and there.
I think I see a crow. Do you see a crow in there somewhere?
Yeah, it looks like it.
Right? It looks like it's a crow in a snowstorm. Totally not my intention. I just kind of just let my hands do the thing, their own thing. And if anybody else has a kit and they want to share, I would love to see all that beautiful artwork. Because this is, again, this is not a competition. This is just putting our emotions on a piece of paper. I'll take some more of this blue, because why not? Oh, my desk is so messy right now. I love it. Like I said, acrylic paint comes out really easily. And speaking of colors, I also wanted to mention that the color green, which is what I'm wearing today, is actually in dedication of Mental Health Awareness Month. So if you are an advocate or you want to make a statement, go ahead and wear green sometime this month, or you can wear it every day. That's just to show that, mental health is important to you. So it looks like I'm done. I don't know. Is everyone else still painting? Or have any questions so far? Because in the kit, you actually have all of the guidelines that I'm pretty much just reading from, I'll be quite honest. But it's something that you can keep for later to do again. And I've also wanted to mention that I put down the website of where I got this activity. It's really cool. Okay, what do you see now? I see a dinosaur.
I see maybe a ship or a boat.
Oh,
Like
yeah.
waves.
Pretty cool. The subconscious. It's pretty cool. Okay, I'm gonna add this. All right, I don't know what this is now. Just looks like a mess. Kind of like my head at the moment. But it's all good. This actually felt really good, and I hope everybody else got a little bit of something out of this activity. And you know what? It took us a whole whopping 20 minutes to cover this. At least it took me 20 minutes to cover this entire piece of paper. So you're more than welcome to stay on and chat with us, but if not, I think this is pretty much it for the activity. Again, I highly recommend, I got all this, it's called vellum paper, which you can get through Amazon. It comes in a nice, it tears out of a, let me just put this up. It tears out of a pad, and it's like 12 bucks, or you can go to Michael's, or if you're lucky, you might be able to find it at like a 99-cent store or a Dollar Tree. Go ahead and grab some, get some paints, and when you're just stressed out, paint, draw, doodle, do something that's going to help you find the piece that you need. So I appreciate everybody coming, and we still have kits. If you didn't grab one, you're more than welcome to pick one up today from the library. The library will be opening in about 6 minutes, and I didn't want to mention that. I mentioned it earlier if you missed it, that the library is open by appointment only, which you can make your appointment going through our website, or you can give us a call at 626-307-1368 to make that appointment. And you can stop by if you want to check out some books, or if you need to use a computer just for an hour, you're more than welcome to do that. And if you need assistance with passports, visit our website. which is montereypark.ca.gov/library to make an appointment, and even our literacy services that are going on. But as we continue to make incredible progress through COVID, hopefully the library will reopen, and I would love to see everybody. So thank you so much for joining us today. Monica, do you want to add anything else?
It's a two-part series that we're having. So we are having a panel and sort of sharing more resources for mental health in the San Gabriel Valley next Saturday at the same time from 11 to 1. If you'd like to sign up for that, you can also head to the Monterey Park Library website and find it there.
Yep. Yeah. Thank you, everybody.
Thanks, everyone.
You see me? Okay. All right. I am covered in paint. I love this. Absolutely love this.